The Virtual Curbside is a production of the Utah chapter of the American Academy of Pediatrics, the Utah AAP, working together to improve children's lives through education, advocacy, and networking. Hi, this is Paul Wirkus from the Utah AAP. Welcome to this week's edition of the Virtual Curbside, where we bring pediatric providers together with subspecialists to get smarter about all things pediatric and better acquainted as a community of caregivers. The Virtual Curbside is brought to you in part by a generous grant from Primary Children's Hospital. Primary Children's Hospital, the child first and always. Attention pediatric healthcare professionals. Are you ready to hear the latest insights on pediatric care? Sort of like you hear on the Virtual Curbside. Join us for the 47th Annual Common Problems in Pediatrics Conference happening June 3rd and 4th, 2025, all virtual. This premier event features expert speakers and cutting-edge topics, all from the comfort of your own home or office. Earn CME and MOC2, connect with colleagues, and elevate your practice. Early bird pricing ends April 4th, so don't wait. Register now at aaputah.org events. Welcome back to the Virtual Curbside. This is your host, Paul Wirkus, this month talking to Kristi Kleinschmit about obsessive compulsive disorder. This has been very, very interesting and very useful, Kristi. Thanks for what we've talked about so far. Are you ready to talk some more?
Yes, I'm ready.
Okay. All right, here we go. So before we do, have you developed any disclosures?
Nope, no disclosures.
I want to talk about one thing that's sort of attached to what we were talking about last week. And we want to talk about maybe some of the less established treatments for OCD. Are there little things that people can do? For one thing, are there any supplements that people should be taking? Any exercises they should be doing?
Yeah, so lifestyle interventions, not specifically. I do think just in general, the more regular you can make things like, good sleep, well-rounded nutrition, all of that is always helpful for anxiety, regular exercise, right? But there's nothing out there that's magically been shown to help with OCD. That said, there is a little bit, it's kind of a supplement, right? So N-acetylcysteine does have a little bit of evidence to support improving OCD symptoms. It's also been, I think we've seen some limited evidence for like some of the other compulsive illnesses like hair pulling and skin picking, and also a little bit with, this is substance use disorder. But anyway, so I don't know if it's just like the drug of the era, but there is some evidence to show some improvements with OCD symptomatology with N-acetylcysteine. So
what about simple mindfulness routines?
Yeah, I think, right, that's always going to help you improve your distress tolerance, which is what we talked about last time, right? So if you can just keep a handle on how, upset you're getting when you are trying to resist your compulsions or you try to get rid of your obsessive thoughts, can't hurt for sure.
Okay. What about apps? Are there apps or digital-based therapeutics that are helpful?
Yeah. So, again, not great data to support this necessarily, but there are a few apps out there. There's something called NOCD, so like no CD. And there's a couple other apps if you just look up OCD apps. But really, it's a way to digitally keep track of your coping skills you're supposed to use, your exposures. You can set reminders to do your exposures in between your therapy times. And so it really provides more of and it checks in about like your distress level. And so more of a structure to support your ongoing OCD, which I feel like can't really hurt, right? Same with like wearables, right? I think you could, if your exposure is supposed to be to get further away from home, right? You could like log how many steps you get in a day, or like, again, no evidence to support, but I certainly don't think could be harmful.
And it's not like there's an app that does your exposure response prevention.
Yeah, I think just it can structure, like you can tell it what to remind you to do.
Okay,
Yeah.
it's more a structural reminder than something that makes you do things that are uncomfortable.
Yeah, I think you can though, you can video. So one of the ones I was looking at, you can actually like have a video of you doing what you're supposed to be doing for your exposure, or you could, so it's almost like you could watch yourself doing it, and that could be some of your exposure.
Yeah. When we talked to Dr. Kendrick a couple of months ago, he talked about some of the more, I don't know how to describe them, therapies that are done sometimes. What about things like deep brain stimulation, TMS, and psychedelic assisted therapy for OCD?
Yeah, so there is some evidence to support deep brain stimulation for refractory OCD in adults. We don't have any evidence in kids for that. I guess if you were at such a horrible, refractory and you tried every single treatment possible, it might be worth getting a consultation with a psychiatrist and a neurosurgeon who are, specialists in that, but certainly can't really recommend that for pediatric populations right now. Our TMS has had some evidence to support in adults with OCD. Again, hasn't been done in kids yet, but certainly a lot less invasive than deep brain stimulation, so probably worth thinking about. And then some of the psychedelics. Did you ask about that too, Paul?
Did. Yes, I
I did.
did.
That's what I thought. No real evidence in teens or kids either for that for anything really. I think psychedelics seem to be, even more prevalent right now than N-acetylcysteine as far as like it's the cure for everything. And, I think the jury's out, and we certainly don't have really any evidence for psychedelics in pediatric populations.
And definitely disclaimer that probably freelance psychedelic assisted therapy is probably not a great idea.
Exactly. Yes. And if you hear of anybody doing like psychedelic assisted therapy for pediatric population, I would be very, very skeptical too. So,
Yeah.
yeah.
And it seems like I think living in a world too where there are things where you have very disturbing thoughts, it seems that psychedelics may not make that better.
Yeah. Yeah.
Okay. We wanted to touch on one thing that maybe we didn't mention a couple weeks ago. Are there good screeners for OCD?
Yeah, so there's something called the CYBOCS. It's the Children's Yale, which is the Y, and then the box. I should remember exactly what it stands for, but it is the sort of original. It's the Yale Brown, sorry, obsessive compulsive scale, and it is a clinician given screener. So it's not just one you can give a kid in your office. It's typically like pediatricians wouldn't be the one to use it, but you could look it up and you could see the types of things that are asked regarding obsessions and compulsions is sort of like some guidance to like how maybe to ask those questions in your office.
And as you mentioned before, one of the things that's important to remember about this is it takes a fair amount of sensitivity to begin with because the things that kids are telling you about are things that are quite distressing to them.
Yeah. Yeah,
And
exactly.
and definitely may have the point of view that other people don't have these same stressors, and so talking about them becomes a very private sort of thing to do.
It can be. And then yes, because they seem so off the wall. And also, perhaps they've had really negative experiences with them already with siblings or parents, even just like, oh, come on, or like, that's so silly. Why would you think that? And sort of, right. And so they've gotten sensitized to maybe that's not a safe thing to talk about.
What sorts of things might come as the biggest surprise for people who don't live with OCD or live with someone who has OCD? What sorts of effects on someone's life might surprise someone?
Yeah, I mean, I think sometimes like just the bizarreness of these obsessive thoughts that come in. I mean, it can, sometimes you can get distressing images of like killing your mom, right? And I mean, how do you talk about that with somebody, right? Or you can truly feel that like in your heart that if you don't like even out, like if you hit your hand and you don't even it out the other side, like that that's not going to cause your dad to get in a car accident today, but you can't, it just the feeling just won't go away until you even out that thing on your body. And right, so it's the bizarreness. And I think it's also just the amount of time that they spend in their brain having these things go on would be really surprising.
What sorts of accommodations can schools make?
Yeah. So, I think certainly teachers, it depends on what the underlying obsessions or compulsions
Sure,
are,
sure.
right? But, as kids are going through treatment, right? Like they might need more time to walk between classes because of, like initially we might have to accommodate a little bit to the symptoms in order to get them to go to school, right? Because if they're not going to school, they're missing out on these social interactions, they're missing out on some of their developmental trajectory. And so, it might be that they need to leave early. Maybe they need to go to like a private bathroom for right now because it's just too distressing for them to use the public restroom around other people. Maybe the teacher needs to have them hand in, like her requirement is they have to have like one mistake on their paper, right? Like almost to accommodate their exposures that they're trying to do, right? I think, the school nurse could be looped in and, maybe they could even maybe they eat lunch with the nurse or eat lunch in a classroom if they have a fear of eating around others or so I think just working with the family and even the therapist if they can be involved in how can we best support keeping this kid at school while also helping them manage their distress.
What kind of resources are available for families?
Yeah. So, there's the International OCD Foundation that has a really robust website and lots of resources that families can look for there. There's something called Anxiety in the Classroom, and this is a website that's for parents, also for teachers and for school personnel. And you can look at a variety of school accommodations that are available, as well as just some ideas for parents to support them. There's this book that I think is really helpful for parents called Freeing Your Child from Obsessive Compulsive Disorder. It was written by Tamar Chansky. Healthy Children has some good resources and certainly ways to talk to your kid, healthychildren.org. And then ACAP has the American Academy of Child and Adolescent Psychiatry has Facts for Families that can be helpful with just some additional psychoeducation for parents to learn more about the illness.
Are there resources available if there's a child in a class who has OCD? Is there a sensitive way to approach that for peers and friends?
Yeah, I mean, I think it really can be just if the kid feels comfortable, like depending, right? I'd like to talk about what OCD is, or, maybe have the school counselor or parents come in and just do some sort of education. Like that's been so effective for Tourette disorder that kids have come into their classroom and just explained what Tourette's is and how they can help the tics that they're doing. And kids have been really lovely. And like once they learn about it, they're like, oh, that totally makes sense. And so I think, yeah, just dispelling some of the stigma and increasing education could be really helpful.
What do we hope for in the future? Well,
Yeah.
we
Oh, go
hope
ahead.
for an easy fix, right? That's not your world, Kristi.
No, it's true. I mean, I think I didn't talk about this earlier, but certainly, there's been a little bit of suggestion that like, trauma can, kind of primes you to develop OCD and other like life stressors could, right? And so, could we determine like, hey, are there things that we can do to intervene after, really stressful things that could help mitigate the development of OCD and, other anxiety disorders as well? Certainly earlier detection and identification, right? Like 2 years is way too long to suffer with these symptoms
Yeah.
before you get diagnosed, right? If you're not hanging out with friends, if you're not enjoying your family, right? At least all of that development that you're just missing out on. And so just more surveillance and recognition. And then as always, right, just wish we had better treatments. I mean, I think, the SSRIs are about 60% effective for this. That's not great, right? I mean, it'd be nice if we had even more effectiveness than that for our first line treatments.
And there again, 60% is a lot better than zero.
Yeah, it's true. It's true. It's true. Yeah, it'd be nice though if there's like 100%, but yeah. And I do think though, like we talked about the app, gosh, I mean, could you have a wearable like a watch or whatever that would, pulse and remind you when to do things and have a lot more ability to do simulated exposures for a lot of these things, right? I think there's a lot of technology that could be helpful with OCD treatment to come.
And for me as a clinician, I think the thing that haunts me is not that I've ever been insensitive to it, but that I have been blind to it.
Yeah.
That am I not asking the right questions? Am I not hearing the right stories to be able to say, oh, there are things that can help that?
Yeah, right. It's a hard diagnosis to get at, right? If it's mostly inside a kid's brain, and
Mhm.
if it's things that are scary or embarrassing to talk about, then it really is something that maybe you just start. I often will ask, are there these images that come into your head that you don't want or that you don't have control over? And sort of like these pictures of things that are scary or that you would never want to do. And sometimes that gets at it. Do you ever have to like touch things a certain way until they just feel right? And those are pretty non-specific and kids will look at you like, what are you talking about? But like the kids who have OCD, they know exactly what you're talking about. And they're like, yes, that happens to me. And then that can be a nice first, or do you have to count? I mean, counting is another one. They'll have to count ceiling tiles or they have to count in their brain and stop. Like they have to walk and count and stop exactly on a multiple of 10. And if they don't do it, they have to start over again. And so I'll ask about counting too, because that's a pretty common one.
Right, right. Yeah. Well, I just hope that, by talking for the last few weeks, I can just be a little bit more able to see it and hear it.
Yeah. Yeah. I mean, I think that's true for all of us, Paul.
All right. Well, thanks so much for your help this month. Anything else you want to share before we're moving on?
I mean, I think just it's highly treatable. And, I think it can feel really scary to families and to kids to think about, like, how do we even start to tackle it? Because it feels so serious. And there are evidence-based treatments. We're lucky. We actually have evidence to support the treatment of this, which is not always the case. And they are effective. And if you get on top of it, you can actually put it in a remission and not have to deal with it for the rest of your life.
Terrific. Thanks so much. Well, thanks for your time this month, and we'll look forward to addressing some questions next week. Those of you out there who are listening, please send your questions to questions@vcurb.com. Thank you, Dr. Kleinschmit, for your time this month. Thanks to Elisa Stoddard for making this sound like a podcast, and thanks, Janice, for listening. We'll see you all next week.
Thanks for joining us. We look forward to getting together again next time. The virtual curbside is available on iTunes or wherever you find your other favorite podcasts. Be sure to like us and subscribe. We want you to like us both because we're needy that way and because that will help other listeners like you find us. Check out our website, vcurb.com, for supporting materials, schedules, and other great stuff. The Virtual Curbside is an educational production of the Utah chapter of the American Academy of Pediatrics. The opinions expressed in this podcast, while carefully considered, are ultimately the opinions of the presenters and not necessarily of the American Academy of Pediatrics or our employers. And remember, the content of this podcast shouldn't be seen as a substitute for seeking actual personal medical care. If this is an emergency, hang up and dial 911. Otherwise, schedule a visit with a caring healthcare provider to try to get to the bottom of your concerns. None of this could happen without Elisa Stoddard, our extraordinary executive director of the Utah AAP. Many thanks to Tim Cosgrove for his help on the website and logo design. Production design and editing thanks to Phil Wirkus, who also composed the theme music. See you next time.